Thank you very much, Program Director, my colleague, the Deputy Minister of Health, Dr. Joe Pasha, the Chairperson of the Council of Medical Schemes, Dr. Mabeba, the Registrar and CEO of the Council of Medical Schemes, Dr. Gumede, and the Chairperson of the Section 69 panel, Advocate Ngwaitobi, and your team. Ladies and gentlemen, thank you very much. I wish to inform you that, well, I'm sorry, they were just showing me that I had an omission of the Section 59 Secretariat. I'm sorry about that. Yes, yeah. I wish to confess to you that the reports given to me by Advocate Ngwaitobi, I'm seeing them for the very first time with you. I deliberately, from April, did not demand to see the reports because I wanted them to be as neutral and as fair as possible without any sort of what people will call political interference. I'm sure Advocate Ngwaitobi can confirm that there was no political interference on any of the things that he has done. So I deliberately stayed away. For that reason, my confession means when you ask questions, don't expect me to comment much about this report. What I know is what I've had with you now. I can comment on that. But we are going to have time to study this report thoroughly and make a statement, official statement from the department. At the moment, we'll just make some snippets. For instance, Advocate Ngwaitobi gave me a very big problem. And I thought that problem is not for ministers or doctors, it's for lawyers. He should have guided me on what to do. He said I must release this report immediately, meaning that I must release it even before reading it, which implies that some of you who are fast readers can finish before me and start firing me with questions while I'm still struggling through. But because it's an instruction from Senior Counsel, I'll carry it through. Senior Counsel, I'll release it and try my best not to sleep, to read as fast as possible. Having said that, ladies and gentlemen, let's not undermine the immensity of this. You will appreciate the fact that when the complaints came, I was the Minister of Health. I appointed this committee. Then I left the department for 5 years to come back to find that the committee is just finishing their work now. So it means it was quite extensive. It's like the health market inquiry. For those who remember, when we started the health market inquiry, we gave them 6 months. But it took 5 years because of what was coming out, the interest, even outside the borders of the country, where people have to come in. I'll believe that this is more or less the same thing because of the sensitivity of this type of matters. Advocate, I accept the criticism, perhaps of the Act and the weaknesses in the Act. But you will realize, ladies and gentlemen, that the manner in which the private sector came into the country was never planned and designed. It just evolved. It just evolved. I was a GP, and I left in 1994 to go to government. There was no Council of Medical Schemes Act. I mean, this Act, which came in 1998, was not there. And when you look at how the system evolved, Advocate, for instance, when I was a GP, I started in 1986. Patients were not required to sign anything. You just see your patients. In the evening when you have knocked off, you take the forms you claim and you send to medical schemes. Why was it like that? Because when this system evolved, nobody was expecting human beings to commit fraud. We're expecting honesty at all times. So the laws kept on piling one on one, because after that they then said, no. Doctor, you can't sign any claim without the patient signing. We had to get the patient sign. And in some instances, it was discovered that patients were signing a blank form, and the doctor comes and fills everything. So they had to change the laws again. Even things like PMBs, prescribed minimum benefits, which are also causing a problem, they were not there. We were just claiming anything you are claiming for, you got paid. Now, when the situation became tighter, medical schemes trying to defend themselves, to protect the public, they came with PMBs, the prescribed minimum benefits, forcing medical schemes to pay for certain diseases but not others, for certain diseases which they regard as serious diseases. That to me as a doctor is a problem, because every patient who is sick regards their disease as serious. You can't tell a patient that, no, your disease is less serious than this other person, so you're not going to be paid for. It's not fair for patients. But all these were attempts to try and contain the situation which is not, which cannot be contained. I was in London last week when Power FM phoned me to inform me about the Board of Healthcare Funders, which represent medical scheme, and Health Funders Association, going to the Supreme Court of Appeal about the LCBOs, the low cost benefit options, because they asked the Council of Medical Scheme, allow us to do low cost benefit options, meaning what? Allow us to pay lesser for certain disease or not to pay at all, away from the PMBs. And of course, the matter went to court. The judge ruled against them. And I suspect that judge was understanding the value of health to human beings. But they were fighting. And I knew exactly why they want to go up to the Supreme Court. They will even go to the Constitutional Court. It's because they want to dodge the PMBs. Yes, they want to dodge paying the PMBs. In other words, they want to dodge paying for certain diseases and give it to the doctors. Some of the doctors may feel, oh my God, no man, I'm not going to be chasing patients. Let me take a shortcut. I'm just explaining, not to justify that some of them are forced into that. So the low cost benefit options, which are going to the Supreme Court of Appeal, are not low cost benefit options. They are low cost, low benefit options. But that low benefit is not being mentioned. And part of it is, so what it means is you need an overhaul of the whole system. That's what I'm trying to say, Advocate. And I agree with you. We need to look at, and you can throw into the mix the issue of the NHI, which is trying to solve some of these things, which is also in court, by the way. And there are already 6 court cases that we sort of dealing with. So we're going to look at this whole thing holistically, not piecemeal. Because if you do it piecemeal, Advocate, we're going to call you again after 7 years to investigate something. So we have to look at it holistically. How do we resolve the whole healthcare system of the country in such a way that it's fair? I have been under pressure from black doctors. They've been complaining that we're not taking care of them, they are suffering. You can imagine having to close your practice because, a certain amount of money is demanded of you, which is so huge that we have got no other way but to close, or not being paid by medical schemes, having only to take cash from people who really don't have that much cash. So the whole system is going to be reviewed. We have got now 2 very important reports. We have got the Section 59 investigation report, We have got the Health Market Inquiry. We have got the NHI Act. We have to find a way how they cross each other, or how they strengthen each other, or how they try to work with each other to solve this problem. So it's still a lot of a way until we're able to find the system correct. But be that as it may, thank you very much. We are relieved. I'm sure those who made the allegations are also relieved that they've been proven to be right. Advocate is very painful, by the way, that now we are dealing here with racial discrimination. So many years after 1994. It's very painful. And I was reminding people that back then, before 1994, many might have forgotten, we had 14 departments of health in this country, with 14 ministers of health. If you think back, it was the 14 departments of health with 14 ministers of health, the 10 ministers of the homelands, the minister of white healthcare system, Indian healthcare system, colored healthcare system, and somewhere in between. We abolished that through our constitution, the interim one in 1993, and the final one in 1996. We abolished that. We are waking up today, by the way, after abolishing that, to find that we are running two healthcare systems in the country that are like chalk and cheese in the way they look like. This is what brought us here. We are running two healthcare systems. One for those who are well-to-do. The difference is that those who were in the black part before have been co-opted, yes, to join them against the poor. And when we mention these, people do not understand it. We don't want two healthcare systems in the country. Otherwise, we'll keep on having this type of problem. Now, within that, those two healthcare systems, one is for the well-to-do. And every day we are being told, advocate, that leave it alone, there's no problem there. Go and fix the mess in the public healthcare system. Leave this one, is doing very, very well. I don't know what today you're saying about that, because we've been telling them, we are not attacking any one system. We simply don't want two different systems. We want the population of South Africa to be able to have access to all the healthcare providers and all healthcare systems in South Africa. And it's not true that the well-resourced private healthcare system has got no problems. This is just one of them. And it's the worst problem ever, that of racial discrimination, many years after we have got a new constitution. So you can't expect us to fold our arms and say, no, one system is okay, it's perfect, we must go and fix the other. We want to fix both. And that's how the NHI Act has been. We've tried to design it. But anyway, as I am saying, when we are ready, after having studied this, we'll issue an official statement to the public about what the departments say about this. These were my preliminary observations after I received this report. Once more, Senior Counsel, thank you very much. But don't expect, you said it's the end of your work. As you handed the report to me, it might not be, because somebody might decide to take it on review. They usually do that. Even the Health Market Inquiry, the report came in 2019, we are still being threatened that it may be taken on review. And the threat of taking it on review only comes when you want to implement it. So if I take it, I go and pack it in the cupboards. There might not be a review, but the day I start implementing your recommendations, you might expect a review. We might go to the courts and call you where you are outside the courts and say, come back, there's a problem here. Otherwise, thank you very much.